Nice to see you again. How are you feeling?
Hi doctor, as you know I was diagnosed with hepatitis B. I went to see the specialist yesterday and we talked about my condition. He has started me on a new medication called Tenofovir. Can you please explain to me how this drug works?
Sure. Tenofovir is an antiviral drug which belongs to the class known as nucleoside reverse transcriptase inhibitors, NRTIs. Tenofovir is an acyclic nucleoside phosphonate, which is an analog of adenosine 5 monophosphate. They inhibit the reverse transcriptase enzymes, which are essential for the replication of a virus. It is administered orally, and there are two types of prodrugs available for tenofovir. They include tenofovir disoproxil fumarate (TDF) and tenofovir alphanamide fumarate (TAF), which are commercially sold as Vired and Vemlidy, respectively. So how does it work? When TDF is orally administered, it is first hydrolyzed, which turns it into tenofovir. This tenofovir is phosphorylated in liver cells, thereby converting it to tenofovir diphosphate. This tenofovir diphosphate holds the activity of DNA polymerase enzyme that is present in Hep B virus. It holds the enzyme activity by competing with its natural substrate, resulting in the termination of DNA chain elongation. This inhibits the replication of Hep B virus in the liver cells. Therefore, TDF stops the progression of the disease and improves the condition of the liver. Let me now pass it on to scientist Tara, who will now explain to you about the clinical trials.
Thank you, doctor. Tenofovir is prescribed for treatment in adults and children older than 12 years. Studies have demonstrated that tenofovir can be used safely in chronic hepatitis B patients, which has been proven in several clinical studies. In a randomized controlled study conducted by Heathcote et al., tenofovir showed to be more effective in patients with the inactive virus compared to the active form. After a year of therapy, it was found that virus DNA was undetectable in 76% of patients with active Hep B and 93% effective of patients with inactive Hep B. Tenofovir used to treat chronic hepatitis B with decompensated liver disease has shown to improve the prognosis. Tenofovir accomplishes this by decreasing the HBV viral load and antigen levels in patients. Clinical trials have shown that tenofovir is effective in preventing mother-to-fetal transmission of HBV. When administering drugs to pregnant mothers, safety is an important factor. Tenofovir is safe to use in pregnancy as it is classified as a Category B drug. More importantly, it prevents HBV transmission. Let's explore alternative drugs. Alternative drugs to tenofovir to treat Hep B are lamivudine, entecavir, and interferon alpha. All drugs are administered orally. With the exception of interferon alpha, an advantage of these drugs in treating Hep B is that the disease is less likely to develop resistance. These drugs, therefore, are more effective in the long-term treatment of Hep B and are often the only treatment option for patients with further complications. Interferon alpha is a less common option as it is not as safe and produces less reliable responses. TAF and TDF are both effective in treating Hep B, aside from a few differences. Due to the different mechanisms of action, plasma levels of tenofovir are higher for TDF than TAF. Because of the lower bioavailability, TAF is associated with fewer side effects and is less toxic. However, TDF is still the recommended drug to treat Hep B, as it is more effective due to its higher bioavailability. Future directions include tenofovir microbicide, and it is currently undergoing clinical trials. Let's now discuss the social impact of the drug. Tenofovir is a drug that has several impacts on patients. In a number of cases, it has been observed that when tenofovir is administered, the levels of virological decay were evident, which means that the drug was effective in treating Hep B, and also it was successful in preventing the virus from replicating further. The second clinical impact of this drug is resistance. Resistance to a drug is one of the most significant issues, as high levels of resistance will render it ineffective. Tenofovir is a drug that can effectively prevent the patient from developing resistance to it, and this can be seen in one study conducted by Lampart et al., where tenofovir was administered to a number of participants for approximately 144 weeks, and at the end of the treatment, there were no signs of resistance. Back to you, doctor.
Thank you, Dr. Tara. So, Jenny, do you now understand how the drug works?
Yes,
Yes.
doctor, I do. Thank you.
created using Powtoon.